here is a myth about dialysis access, dialysis fistulas and grafts. If the access looks fine, it's working fine. And that's completely wrong. You can't really tell how the access looks from the outside. But there are several signs that tells us if it is working well or not. First of all, you should always have a good thrill over the access. And you should check your access on a daily basis, essentially, to see if there's anything changed. If once you had a thrill, which is something like a cat purring, and then the access becomes pulsatile, that may be a signal that you have a narrowing in the access. Also, if it was working fine before, now it's taking longer to stop the bleeding after dialysis, that's also a sign that there may be a problem. Sometimes the nurse may tell you that there's decreased flow or the machine's alarming a lot. That's also a sign of a problem and you should seek help. Other signs of dysfunction could be that you develop arm swelling. That usually means that you have a narrowing in the central veins, which is the veins in the chest. Or if you're having hand pain, that's also not normal. It may indicate that you have something called Steele syndrome or there is something else wrong, but it needs to be checked. So the myth that just looking at the access you can tell if it's good or not, that's wrong. But actually feeling the access and watching what it's doing can give clues that something wrong may be going on.